Okay, we're back. We're live. We're here on, I guess you could say it's Hawaii, the state of health, which is organized by the State Department of Health. And we have with us today Keith Ridley, the program manager of the Office of Healthcare Assurance at my far left, and Peter Whiticar, branch chief of the STD/AIDS prevention branch, I guess, of the State Department of Health. And today we're going to talk about medical marijuana. And there are programs in the State Department of Health we want to discuss since the bill just passed. Has it been signed?
Not yet.
Okay, all right. So, but there is every indication it will be. Has he come up with a veto list yet? You know, there's a requirement that he come up with a veto to say what he's inclined to veto. I'm not sure he has yet. I'm sure it's required yet, but that'll be an indicator of whether he's inclined to sign or not sign, or veto or not veto. Okay, anyway, so I guess the first I want to say hi to you guys and thanks for coming down.
Thanks. You're very welcome.
And it's great to have this program. Shout out to Miley Sakamoto, who puts these shows together. Thank you, Miley. Okay, and the second thing I want to do is set the stage. So let's do that with you, Peter. You know, we've had talk about marijuana for the last several years. We've had some bills passed before this year. We had what appears to be a really significant bill passed this year. That's the dispensary program bill. But can you give us the continuum of how this legislation came about and how it's working on a continuum?
Yeah, thanks, Jay. I think that's a good way to start, because there just is so much discussion about marijuana, not just here in Hawaii, but on the mainland.
Sure.
And folks that are reading the media, they're not sure what's about Hawaii and what's about the mainland. So starting in Hawaii, we were one of the first states in the country to have medical marijuana. And the thing that was interesting about Hawaii, it was passed by the legislature. It was not through a public initiative process. So often people that are consuming media see that there are big changes in medical marijuana or marijuana programs. Those are often driven by popular initiatives where the population is voting. In Hawaii,
like in Colorado.
Like Colorado,
and
Oregon,
Washington, Oregon.
Yeah, Alaska. In Hawaii, it was passed by the legislature, and that was in the year 2000. So since the year 2000, Hawaii has had a legal medical marijuana program, and we can talk a little bit later about what the requirements are. But the interesting thing about that law was that there is no provision for dispensaries. Patients or caregivers were allowed to grow their own marijuana, a very limited number of plants, and possess a limited amount of marijuana for their own use. But if they couldn't grow or they couldn't get it through a caregiver, that meant that they need to purchase their marijuana, marijuana medicine on the black market, and thus
that's not much of it, yeah.
Being part of an illegal activity.
Yeah, so the law that contemplates an illegal activity is what it is.
Well,
you can't do it unless you get to it.
Yeah, it's a law that provided a great help for many people because they could grow their own, but for those that couldn't, or people that were too sick or too old or really had no gardening experience or place to grow.
Have they been doing it?
They were pretty stuck. Many have.
Take a risk.
Well, in terms of growing, you mean?
In terms of, yes.
Yes, no, many of them have been growing. And what we're finding is, of course, that many more are growing, say, on the Big Island, where there's more possibility, more land, more agricultural space than, say, an urban area of Honolulu, where it's pretty difficult to grow your own.
That's appropriate
marijuana.
because the
Yeah.
Big Island has been growing pot for a long time.
There were some experienced growers there, perhaps. But for years, there was pressure from an activist community, from the medical marijuana community, to allow for a dispensary so people could legally purchase marijuana. And not only legally purchase it, but know what they were purchasing. So what's the quality, what are the characteristics of the marijuana?
So as part of that continuum, you start out with the dispensary program?
No, we start off with a registration program. That's right, so people are legally registered to
for
possess
healthcare.
And use, that's right, for medical purposes.
And then you work toward the dispensary
Dispensaries are the next step, and that's the bill that's just been recently passed. And then, but this is not to be confused with legalization or recreational use. That's now in 4 states. So Alaska, most recently, Oregon before that, Washington State, and also, of course, Colorado that everybody knows about. So, and even in those states where there is legal recreational use, they still have medical marijuana.
Yeah.
So that's really the 3, let's call them stages. And
it starts this way all the time, right?
It doesn't always start this way. In fact, many states, when they started their medical marijuana program, started right away with the dispensary system, especially the more recent ones. They realized that if you are going to be a patient of a medical marijuana program, you need safe, controlled access to your
What I mean
medication.
is usually you start with the medical aspect of it, medical use of it, one system
Right,
or another,
right.
and then you go to recreational. And none of these states we've mentioned went directly to recreational.
No, that's absolutely correct. Although I think it's really fair to say that it's not necessary if you get to the stage of medical marijuana that the next step is necessarily recreational. And of course, that's the debate for politicians, legislators in our community.
Well, has it, in any state that we are aware of, has it gone to, the registry program and the dispensary program, but not to recreational use?
Yes, there's many states, because there's 23 states that have some form of legal medical marijuana, but there are only 4 states that have recreational marijuana. Now, some of those states have just fairly recently started medical marijuana. You're hearing about them all the time in the news. Every year there's a few more. And most of those have dispensaries, but certainly not all of them have gone to recreational marijuana.
Okay, well, let's take a moment and talk about let's see what we should start with, so everybody can understand. The registry program, under the existing law before the dispensary program that just got enacted, what does it call for?
Well, that's for the medical marijuana program that started in the year 2000, and little known by perhaps many people in Hawaii, there are 13,000 patients. And to be part of that program, you have to have one of relatively few debilitating conditions. Cancer is one, HIV is another one, glaucoma, severe chronic pain is another one. You have to find a physician who will diagnose that and is willing to certify that you are a patient that has that diagnosis. Submit your application to, it was to public safety. The program was run for 14 years by the Department of Public Safety, only came over to the Department of Health in 2015.
Public safety is the department that runs the prisons.
That's correct. And some patients, I would say many patients and many in the community felt that this was not the appropriate placement for a program that's facilitating access to legal medical marijuana in a department whose mission is really to, I would say, to suppress the use of drugs. So that's why there was such a push to move it over to the Department of Health, where it would have maybe more of a public health focus.
Okay, and when it came over to you.
That's right.
As the branch chief of the STD/AIDS prevention branch. But you mentioned before the show began that you're going to change the name of that.
We are,
particularly in view of this change in the law.
Yeah, because we want a name that really allows patients that are signing up for the program to feel that they're not really stigmatized in any way by being part of under an STD or AIDS program, because there isn't a very strong connection. I think the reason that we got it is because we're used to dealing with law enforcement, we're used to dealing with physicians, we're used to dealing with patients, particularly in HIV, and often somewhat unconventional, somewhat stigmatized, and somewhat, at least initially, difficult to introduce programs.
You're problem solvers down there.
The Bureau of Stigmatized Public Health Issues, yeah.
So what have you been doing under the existing registry law?
Well, the first thing we had to do was make provision for the 13,000 existing patients and then be able to bring in new patients. And we had really limited staff and resources. So one of the things that we've developed is an online application system that's not fully complete, but should be complete in the next 6 months. And that will eliminate the paper applications. So this should make it much easier for patients and physicians, should make it quicker for the cards to get out to the patients so they can legally use their medicine. I think one of the things we're happiest about is we've really increased the amount of information that's available to the public. So we've set up, I think, a very successful website that has a lot of question and answers so that people in the public that aren't too sure about it, whether they're physicians, patients, or even law enforcement, they can have a look at that website and really have many of their questions answered. I guess the last thing that we've done is we worked really collaboratively with law enforcement because, whenever you're talking about marijuana, whether it's medical or recreational, there's a very necessary and important role for law enforcement because marijuana use is prescribed by law, and it certainly remains against federal law. So we've developed a system where law enforcement, if they run into a patient, the patient doesn't have their card, they can verify very easily whether the person is part of the Department of Health program.
So the thing about the registry where they apply, they go online, whatever, they're in a database now, you have the database.
We do.
And it means they have a medical permission, doctor's permission to do this or
A doctor's certification.
certification to do this, and that plugs directly into the dispensary program, doesn't it? The dispensary program sort of wraps around the existing law.
Well, I think that's what we're looking at. Maybe Keith will talk a bit about a little later, but it is only those patients who are registered in the medical marijuana program, in the registry program, that are going to be able to access the registry program. So you're right, it really is one of the foundation steps.
So to the extent that you've been registering people for the past 15 years, I guess.
In the state, and for us in the last 6 months.
Yeah.
Right.
Now, I suppose you're going to have a lot more registrations because of the change, the adoption of the dispensary program.
That's a very good question, and we believe so. So we're expecting there will actually be more applicants now that it's in the Department of Health rather than Public Safety. And perhaps as we do a better job at education of physicians, they will start to feel more comfortable in certifying their patients as well. And then, of course, once the physicians and the patients realize that they can potentially purchase their medication legally in a dispensary, that's really going to potentially increase the demand as well.
We're going to go to a break in a minute, Peter, but I get the sense that from not only from you guys, but from everybody I know, that this is big. And it's a burden or a challenge to government to be able to deal with a change in social mores, a change in, even though we've had a registration system, this is still going to change things. How do you feel about that? This is, sort of a major undertaking, isn't it?
It has been a really major undertaking, but I think we want to be responsive to the laws of our state, and I think we want to be responsive to the spirit of the laws. And I think when the legislators made these laws, they heard from a very, very diverse group of stakeholders. They heard from people that do not want marijuana to people that really they think it's saving their lives. So I think we really need to trust in the legislative process, and then in public health, do our job, or do the best we can to make sure we're doing the best for our patients. And with a public health approach, we really do focus on our patients. They are our key stakeholders in this process.
It's almost like the Department of Health has been waiting for, 100 years for a challenge of these dimensions, and that you're ready.
I was going to say, in my job with HIV, we were presented with a very significant challenge 20 years ago with HIV, and I think many of my colleagues would think they've had significant challenges too. But you're right, this is one that involves a lot of uncertainty because there's so little research around medical marijuana. And typically in the Department of Health, we like to make decisions based on solid, strong scientific data. And that's really one of the foundations of public health. We like to use data. That's how we're informed. And with medical marijuana, because there's been so little research permitted by the federal government, we don't have that strong foundation. So we have to really depend on our legislators to chart our course.
And be as scientific as you can in the circumstances.
Exactly. And hopefully use the opportunity in the coming years as marijuana becomes more available for medical purposes to really engage researchers and make it more legitimate. And I would say really talk more straightforwardly to the federal government about the importance of rescheduling medical marijuana so that research is easier to carry out. More funds will be available. Universities will be able to jump in, and even NIH should be doing research on marijuana.
Is that happening in the other states which are advancing on marijuana?
Some states are really trying to build research in from the start, and it is difficult. It remains difficult because of a range of federal prohibitions, even getting the marijuana for the use of the research. Right now, I think many of us are relying on research that's been done in other countries. Israel particularly has done a lot of research and small studies that have been done. But if we really want to get to the, I don't know, a deeper level of understanding for medical marijuana, we need to have broader, very well-established, longer-term studies that can look at not just the short-term effects, but really the longer-term effects.
It's a great opportunity, actually.
Yeah, it really is.
Not only to understand fully what, the way this is going to work in Hawaii, but to have research and data and, scientific conclusions that can be useful elsewhere in the world.
Absolutely. And I think many patients are really looking for this research. People want to know what's going to help them. And many people turn to medical marijuana, I would say particularly people with chronic pain, as a way of finding relief without using prescription painkillers, particularly opiates, which they find is almost as debilitating as the pain in the first place.
Yeah.
And as we know, causes such levels of addiction. So I think it's really important we get a better handle on what works, what's dangerous, and if marijuana is to be used as a medication, how is it to be consumed, through what method, how much of it, which strains of it, whether it's to be eaten or smoked or whatever the process is
It's
going
a
to
great
be.
opportunity, really,
Yeah.
scientifically.
Exciting.
Let's take an opportunity for a break, too. We're going to take a short break, and we're going to come back and we're going to talk to Keith about the dispensary program and how he's going to be able to implement it. Just almost signed. We're about to start on the first yard line. Okay, we'll be right back after the short break.
This is Alice Lee Hagan, host of ThinkTech Hawaii Business Education Spotlight. My show here at ThinkTech Hawaii is every Thursday from 3 to 4 in the afternoon. I bring in interesting guests from Hawaii, the mainland, and hopefully international guests in the future. Do join us on Thursday from 3 to 4 p.m. ThinkTech Hawaii Business Education Spotlight. Aloha.
Aloha, my name is Josh Green. I'm a senator from the Big Island. I work in the ER there. But on Tuesday afternoons, I get to come and spend 45 minutes to an hour with Jay Fidell and the ThinkTech staff. They're terrific professionals. They help us to bring some of the leading cutting-edge topics here across our state to you. So you can join us at our show on healthcare in Hawaii to talk with leaders from across all the spectrum of health in our state, or you can join us for any other show where we talk about economic development or tourism, or some really eclectic programs too. So really, we'd love to see you here on our show. Thanks for joining us, and thanks for supporting us.
Okay, we're back, we're live. We're talking about medical marijuana in Hawaii and programs in the Department of Health, which are going to implement the legislation that is about to be signed, we believe, by the governor. So far, we've talked about the registry program with Peter Whiticar, and now with Keith Ridley, we're going to talk about the dispensary program. The registry program has existed for a decade or, 15 years anyway. It only recently passed over to the Department of Health.
Right.
And now we're going to talk about, the brand new statute, the brand new approach to the dispensary system, creating it out of whole cloth, right, Keith?
Right, absolutely. We are expecting the bill to be signed. It hasn't been signed yet. And with the short time frames that are included in the bill, we know that we have to start ramping up even before it's signed. But certainly on the expectations of it being signed by the governor, we're already beginning to make plans for how to stand up the dispensary licensure program.
Exciting. So, in a general sense, what does the law call for?
The law allows for 8 licenses to be provided statewide. Depending on the island, there's 3 on Oahu, 2 on the Big Island, 2 on Maui, and 1 on Kauai. So those are the 8. And it's island specific rather than county, so that, for example, 2 on Maui or Maui Island doesn't include Lanai or
So there wouldn't be
Molokai.
one in Lanai or Molokai.
That's correct, that's correct. And so these 8 licenses would also then be further defined in the law as allowing for 2 production centers and 2 dispensaries per license. So when we talk about 8 licenses, we're really talking about 16 production centers and 16 dispensaries, 32 potentially separate locations that are spread out throughout the state.
The production center is a place where you grow marijuana.
Production center would include where it's being grown or where it may be manufactured and changed into a product. So and all of these are defined by law in terms of what the production center is and what the actual products that would eventually be used for retail sale in the dispensaries.
Mm-hmm. And the license also contemplates that there would be a location to sell at retail.
Correct, and that's the dispensaries.
Yeah, okay. This is pretty exciting because you have no idea how it's going to play out. Who's going to, well, maybe you know who's going to do it. I mean, are there people already, let's say, like the Oklahoma land rush, you know?
Right.
Are they at the starting line, ready to file their applications?
Well, we're hearing that, and a lot of it is anecdotal. We have gotten some calls from interested individuals. Nothing is submitted on paper yet. Again, the bill hasn't yet been signed.
Mm-hmm.
And there will be a period of time for us as a Department of Health to come up with the rules or the regulations on what's going to be required as part of the application process. What information will an applicant have to provide to us? And as well as what would qualify someone to hold a license. It might not necessarily be the same as the process or the requirements for submitting an application.
Yeah. Well, this is so interesting. So I get it from you that this bill is pretty detailed. You know, right down to how many dispensaries and licenses on what island and all that. But it also leaves a fair amount of discretion in the State Department of Health as to exactly how to implement that. For example, the kinds of things that you would include on the application, the kind of information you'd want to get, that's up to you, right?
Not necessarily. There is a lot of information that's in the bill, 70 some odd pages of bill.
Is that right?
And so the legislature did go into some amount of detail, but you're right in that when the department has to come up with what these processes are and what the final requirements will be, there's a little bit of latitude, but it's really using the structure of the bill as the framework for what else might be provided within the regulations.
Sure. You know, and you know, as you guys were talking about, I mean, there's a lot of people who participated in this legislative process, and so those people presumably are going to be around it in one way or another as it goes forward, have already given you a lot of their expertise, so to speak, on how to do things, and it's in the bill. But how do you see ramping up for it, Keith? I mean, what do you got to do?
Well, the key thing is what we need to do is to ensure quality and safety of the products.
Yeah.
That's what we're doing as a Department of Health. And the program that I'm responsible for does licensing, inspections, or surveys, we call them, of healthcare facilities throughout the state. So we have a history of doing these kinds of surveys to make sure that agencies and facilities and institutions and other organizations comply with state law. What does it require of someone to be a skilled nursing facility or a hospital or an ambulatory surgery center? So we're going to have a similar kind of thing with medical marijuana licensing, whether it's production centers or dispensaries, or actually all of it.
The difference is, in this case, you know, for the medical facilities in general, you're talking about the safety of medical facilities as rendering medical services. When you're talking about the marijuana bill, you're talking about regulating the actual production of the marijuana. That's different.
Well, not quite. It's not quite that different.
I want you to tell me.
In terms of what we do for healthcare facilities, for example, our main mission is to ensure the safety of the patient that goes to the facility.
Okay.
So similarly, we want to ensure the safety of the medical marijuana patient who goes to the dispensary to pick up their medical marijuana.
But in doing that, you're gonna have to look at the agricultural side and the processing side.
We will look at the products that result. There are requirements in terms of the amount of marijuana that can be grown, that can be produced, and how that can then be turned into products that would then end up for sale in the dispensary, both in terms of quantity and in terms of quality and safety. Again, we come back to the quality and safety aspects of it. We want to make sure that the products that are being sold to the medical marijuana patients don't have contaminants, don't have mold, and these sorts of things that might otherwise be found in green leafy vegetables that you might buy at a market, you know, and we see those kinds of of advisories to be sure to wash your lettuce and wash your tomatoes, those sorts of things.
This is not unlike your pass-fail system in the restaurants. You want it to be wholesome, clean,
Sure.
no contaminants, safe for the public, and
That's right.
therefore you go and you inspect. You have a plan for inspection?
That's right. And so in order to achieve that goal of quality and safe products for the patients, we have to ramp up this entire process beforehand and look at what is it going to require in order to achieve that end result. And some of the things are, do we have staff who will be doing those inspections? Do we have staff who will be managing the program? Do we have regulations? So we've got to write regulations, and the bill calls for interim regulations to be written by the end of this calendar year.
Ooh,
and
that's a lot of work.
That's a lot of work in a short period of time, as well as coming up with a process and criteria for selecting applicants who will, or to apply, and then the selection process on who will actually get a
And
license.
that's in the same period of time?
Pretty much.
Yeah.
We want to be sure that any potential medical marijuana dispensary license applicant knows what they're going to get into from the standpoint of what they have to submit to us in application and what they're going to have to comply with once, hopefully for them,
They
a
pay you
license is
overtime at
provided.
the Department of Health?
Not yet.
You may be pushing on that boundary this fall. I mean, both of these happening at the same time. It's so many details, so many new ideas and
Right.
new issues and new concepts in play. Wow.
So we've got a lot of resources that we've got to marshal together for this. We've got our Human Resources Office working with us on helping to prepare position descriptions on brand new positions that are going to be created. We have our Attorney General's office and the Deputy Attorney General's working with us on beginning to come up with interim rules and interim requirements and processes for submittal of the application and the selection process. We've got to find space for the people that we're going to hire. So we've got our physical plant people looking at where do we have office space available? And if we don't have office space available, where can we get it? So there's a lot to do in a very, very short period of time.
Yeah.
And on the expectation that the bill is signed, this program starts July 1.
Is that the effective
And
date?
so that's the effective date of the bill. The effective date of the dispensary being able to dispense marijuana isn't until next year.
What time
July
next
of next
year?
year, July
next year.
15th.
So that gives you a year to settle things down. This is not a whole lot of time.
Well, it gives us really less than 6 months, or about 6 months, to have all the interim stuff done, which means we've got to have staff hired before then, which means we've got to have, drafts that are going to go back and forth to the attorneys
Sure.
for review done well before then as well. So although the dispensary program starts July 15th, we're really looking at a program that for all intents and purposes starts in December of this year, because that's when we start notifying the public and we notify potential license applicants on what the criteria is going to be.
Do you feel honored or overwhelmed?
A lot of both.
So, have you been thinking about this? I know it hasn't been signed, but have you been thinking about the kinds of things you would require, the kinds of positions you would establish?
Yes.
Go ahead.
Yeah, we've been thinking about it for a long time, actually. Again, in anticipation. And as the bill was going through the legislature, and all the permutations that it was going through during the course of all the public hearings, et cetera, wondering, okay, now if it goes this direction, what are we going to need?
Yeah.
If it goes in this direction,
Yeah.
what are we going to need? So we've been giving this a lot of thought throughout the course of the legislative session.
Now, one of the things, of course, that you'll also have to do, both of you, I think, will be to educate the public. Because right now, there's an awful lot of speculation about exactly what this is going to do, how it's going to be rolled out, how it's going to be implemented, and how the individual can use it or maybe not use it, how it's going to affect the community in general. I would say just as an ordinary fellow that this is going to have an effect on the community. People are going to have to know about it, or there will be confusion, and confusion, leads to failed programs, actually. So in order to make it work, you have to get out there and educate people. This is such a big question, we ought to take another break. And then we come back, we'll see if we can address it a little.
Okay.
Okay, Keith Ridley, Program Manager of the Office of Healthcare Assurance. Also to my left, Peter Whiticar, Branch Chief of the STD/AIDS Prevention Branch of the State Department of Health. Talking about medical marijuana today, and we'll be right back after this short break.
Aloha, I'm Hunter Hevlin, host of Sustainable Hawaii here at ThinkTech Hawaii. You can tune in every week on Thursday at 2 p.m. to see interviews with sustainability professionals from around the state and even further abroad, learning about activities with water management, food security, waste management, and a whole host of other fascinating opportunities to get engaged with making a greener island. So if you're interested in making the transition from consuming individuals to communities of producers, check us out every Thursday.
Aloha, my name is Paul Jackson, better known as PJ, and my local interest is in sports. I have my own sports radio show at KWAI AM 1080 that you can stream live. I also have my own website, pjsportsradio.com. We have live guests in studio, and we talk about discussions and topics that everyone wants to know locally here on the islands. We cover everything from surfing to basketball to whatever's going on locally, sports-wise. We try to do our best and cover the topics in depth as much as we can. Once again, thank you for joining PJ here on Hawaii Sports Update.
Okay, we're back. We're live. We're here with Keith Ridley, Program Manager of the Office of Healthcare Assurance, and Peter Whiticar, Branch Chief of the STD/AIDS Prevention Branch at the State Department of Health. We're talking about medical marijuana, and indeed, there is the bill for the dispensary program of medical marijuana sitting on the governor's desk right now, and it would take effect, what, July 1st as the effective date, and the actual dispensary, infrastructure would go into operation a year away from July 1st.
Correct.
Okay, so let's talk about how much the public knows and how much they need to know and how much engagement you've got to have, both of you have got to have with them to make this work. How are you going to do that?
Well, the department already has a Q&A type of information on the website, so anyone can go, whether they're a medical marijuana patient or just curious about the program, can go on the Department of Health website and look at the frequently asked questions that are posted there. And in the very short term, we're going to be using that as our primary vehicle for providing information to the public. But one of the things that we certainly do recognize we need to do is to create a more robust communications program around this whole rollout of medical marijuana dispensaries. And to the extent that we need to certainly engage or include the registry program in that, and what the kinds of diagnoses that qualify someone to be on the registry, we'll need to include that as well. So we really want to take both programs, the current program with the registry and the expected future program with the dispensaries, and really kind of package them together so the public is aware of what all is necessary as a potential medical marijuana patient from the standpoint of being certified with those diagnoses, all the way to the nth stage of going into a dispensary and purchasing the medical marijuana.
So it's a one-stop shopping thing where both of your offices will be on the State Department of Health website, and I can look you both up from that website.
Yeah, we're hoping to really work very closely together because from the perception of the public, medical marijuana is really one unit. Internally, we're split in how we're administering it, but we're really trying to look at it from the perspective of the public. And, one of the things we're doing is not only educating it, but I think we're trying to overcome a lot of miseducation that's out there. If you speak to anybody, they all know a lot about medical marijuana, and probably the dispensaries, right? What's right or wrong is really a lot for conjecture. And the place to start for people that are interested right now, and many of your listeners are interested right now, would be to start with the bill. And the bill is available on the website.
It was 70 pages long.
It's 71 pages long.
A summary would be helpful.
The devil is in the details.
Of
So,
course.
If you're going to be applying, it's important to know that. And that's really what we're starting from. So it's important that everybody in the public, and especially those that are interested in applying to run dispensaries, feel that the system is working very fairly, openly, and transparently. So when we do make information available, it needs to be made available to all people at the same time. And I think we're very conscious of that, and that's part of why we're using a website at this point for getting all the information out.
One thing that Keith said, which struck me as interesting. In fact, you both talked about this. The bill has a list of medical conditions that qualify for registration. The bill has a list. And yet, and then there was an addition to add PTSD to that list in this year's bill. But, you know, there's other things, right? Medicine changes.
Right.
There's all kinds of new things come up all the time. Research will find that marijuana, if it helps this category of condition, it could also help this. So do you guys have the power to add conditions to that list, or do we have to go back to the legislature?
That's an excellent question. So with the original legislation of the year 2000, that original list of conditions was established, and since then there has been no consideration of additional conditions. However, with our new administrative rules for the registry program, which will very soon be going to the governor for his signature, there's a provision in there to allow petition to the Department of Health every year by physicians, patients, and the public to provide us with scientific, with our own experiential information on what has worked for them, what worked for other people in other places, to try and give us a scientific basis as much as possible with a limited situation to make a decision whether to add a condition.
And
or
you
not.
would make that, the department would make that
decision. That's correct,
decision.
yes. No, we would do it on the basis of recommendations from whoever really is knowledgeable. Ultimately, it would be the director of health that would make that decision.
How about the other side of it? Suppose there's a condition that's not really appropriate for marijuana. It's just, you know, when we made the list, we were being luxurious in some ways. So we find now that it really doesn't qualify. Could you take it off the list?
There is a provision for removing from the list, or certainly putting an advisory out to physicians that it's not appropriate. I mean, our worst fear, of course, is that medical marijuana would make conditions actually worse. It would exacerbate the situation. So we definitely do not want that to happen. The other thing that's potentially negative, if people are using marijuana where it may have little or no positive effect, it means they may not be looking at other more traditional medications. And if you have a serious health condition, you want to be using the optimal medication, whether it's marijuana or something else. So you don't want to be falsely assured that your marijuana is doing something for you if it's really not. So that's sort of the flip side of marijuana as a medicine.
Yeah, that's a challenge for the doctors. I mean,
It is.
They have to give the full advice on these things. They can't just go to marijuana and say, there's your panacea.
Well, and that's why it's very important, both, and it's established in this law and in our administrative rules, that there be a bona fide relationship between the physician and the patient. So it's really important that the physician is looking at his patient's condition, diagnosing that condition, making them aware of the pros and cons of medical marijuana use, making them aware of other medications that may be more suitable for their condition. So the bill is really founded on a strong patient-physician relationship, not just a physician that's going to certify them and say, go off and good luck with your medication.
Yeah. I mean, in the way of humanity, that is something you do want to avoid. So going back to what you were talking about before, Keith, namely the process of taking the applications, and what Peter was talking about in terms of the political aspects of going forward on this. I can see a lot of people in this state would like to create companies to get those licenses, be funded offshore with lots of money in order to build the necessary growing and processing units. And it's, at least theoretically, big business, theoretically profitable, to the point where money would come in from offshore and people would have expectations of earning a lot of money. And that means lots of competition. When they come around and file these applications, I can guarantee you here today at this table, there'll be more than 8 applications. I can guarantee that. What are you going to do when it gets hot in the kitchen?
Well, that's where the selection process is going to be very important, and we've got to announce that selection process even before we receive applications. We want to be sure to be fair to everyone, and this process is very important and critical to to be implemented well before we start to receive these applications. So we have to identify what's going to be required as part of the application process. We've got to identify the criteria for selection of the licensees, and that's all part of what we've got to come up with within the next few months before we make the announcements to the public. And so I'm imagining, for example, that where the bill lists different kinds of criteria for and documentation that has to be provided as part of the application process, I'm envisioning a process where we start adding to that. Because if everybody submits the same thing and they have the same qualifications, and there are these more than 8 applications, there would be no legitimate, fair, to some people, way for us to identify and to license which 8 of the 100 applications to license.
It won't be easy.
And it won't be easy. So we've got to come up with a process, and that's part of what we're working on, a process of identifying what that criteria is going to be, so that if 100 of them come in with the exact same thing, what differentiates the 8 from among the remaining 92?
You're going to put this in front of a panel, a board, a commission, some group?
No?
Just to do it in-house, do it with the existing decision-making process?
We'll do it within our own decision-making process. That's something that the bill allows us to do. And these are part of the interim rules that we are required to come up with by the end of this calendar year.
One more thing before we close, we only have a few minutes left, and that is going back to the continuum, if you will.
Yeah, right.
So we're on the way, at least if you follow other states, to recreational marijuana. What has to happen before we get there? And how does your experience under this bill just about to be adopted bear on the likelihood of recreational marijuana in our future? Sorry, I asked you.
Well, you know, I think we can learn a little bit from the states that have gone through that process. So there are 4 states, and the one that has the most experience, of course, everybody knows, is Colorado. And my colleagues in Colorado started with a medical marijuana program, and then they had a voter initiative which instituted the recreational program. And they said if they had to do one thing over again, they would set up a very well-regulated medical marijuana program first, where they would get a solid basis in medical marijuana, where they would have a good registration system, they would have a good tracking system.
Legal infrastructure,
Right.
Administrative
Right.
infrastructure.
So it's solid. And that they also recognize that there's a real public health role that's beyond just the regulation. So that's issues about, should you be smoking marijuana if you're a pregnant mother? When should you be smoking or not smoking if you're driving? What jobs can you be doing safely if you're taking marijuana? If you are taking marijuana as a medication, is that safe in the workplace? So there's a whole range of issues that are traditional public health issues that they need to develop the capacity to look at too. And one of the things that they wish they'd done was collected a lot more data. So are there more car accidents where substance use is an issue? Are there materials informing women? Not necessarily about the risk, because we don't know. There's so little research. That's the problem. We often don't know, but that there's a potential risk. And we just know that smoking for pregnant women is not a good idea, so probably smoking or consuming marijuana may not be a good idea as well. So there's a whole undeveloped public health role, and hopefully through this program we will develop a solid foundation. Even if it just stays with medical marijuana, we need that solid foundation. Yeah. But if it does progress, or the politicians decide our legislators decide we're going to move forward, then we'll have a solid basis.
And you'd be much better off if you have a solid foundation.
That's it.
In fact, if you don't have a solid foundation, that really stands in the way of the next step, whatever it might be.
It does, and it really jeopardizes the program in a way too, because law enforcement feels uneasy, school parents feel uneasy. There's just not. It feels like it's getting out of control.
Well, let me let me go to you, Keith, for the final statement here. What would you like to leave with the public about this? It's a difficult moment, a challenging moment, but it's a turning point of some sort in our social structure here in Hawaii to have this. It will change things. What is your advice to the public? There's the camera right there.
The advice is for them to really pay attention to the advisories that we put out and the information that we put out. keep informed. There is a lot that the Department of Health has yet to develop. So we don't have all the answers right now anyway. But it's important that the public know that we're doing our best in order to ensure the safety and quality of the products in order for the medical marijuana patient to then be safe as well. Information will be forthcoming. It'll be on our website and it'll be communicated hopefully in a variety of other ways as well. So stay tuned to the website. Continue to go to the website and see what new information we post.
Thank you, gentlemen. Keith Ridley, Peter Whiticar of the Department of Health on medical marijuana. Thank you so much.
You're very welcome.
Aloha.
Thank you.
Let's do this again.